Swimmer's itch, aka cercardial dermatitis. What is swimmer's itch? Swimmer's itch is a rash caused by an allergic reaction to parasites that dig into the skin while swimming or standing in warm water. What are some symptoms of swimmer's itch? Within the first few minutes of swimming in contaminated water, you'll feel burning, tingling, itching, and within the first 12 hours of swimming in contaminated water, small red pimples will appear. Also, these small red pimples can turn into blisters. How do you treat swimmer's itch? Usually it clears up in a week on its own, but in the meantime, you can use over-the-counter antihistamines, use anti-itch cream that has calamine, do not scratch it, cover affected areas with a clean, wet washcloth, and if itching is severe, talk to a doctor about getting prescribed medication. So how do you prevent swimmer's itch? Wear swimmer's itch guard. Choose where you swim wisely. If possible, stay away from the shoreline. Rinse after you swim. Don't feed the ducks. Apply waterproof sunscreen. How is swimmer's itch transmitted? Swimmer's itch is transmitted because the parasites from infected snails are in fresh and salt water. The parasites prefer specific birds or mammals as hosts. How is swimmer's itch transmitted? Swimmer's itch is transmitted by the parasites that are from infected snails, and it is in both fresh and salt water. The parasites prefer specific birds or mammals as hosts, but if they come in contact with a human or a swimmer, they will dig into the skin, which causes an allergic reaction. The preferred hosts are ducks, geese, seagulls, swans, muskrats, and raccoons. So what is the life cycle of swimmer's itch? The life cycle for swimmer's itch is the eggs of the parasites end up in the water. They hatch, and that releases a small microscopic larvae. While the larvae swim, they look for a specific kind of aquatic snail. Once they find the snail, they infect it and multiply and continue developing. Infected snails release a different kind of larvae into the water. This larvae searches for a suitable host to continue the life cycle. Humans are not a suitable host, so after invading human skin, producing an allergic reaction, they will eventually die.